Welcome back, dear viewers, to a new episode of Doc Talk, and today we're going to discuss blood clots, often referred in the medical realm as the silent killer, and oftenly and widely represented as one of the most serious and underestimated health risks. And in today's episode, we are joined by Dr. Fawzeya Alkhaldi, medical internal medicine and clinical hematology consultant, Canadian and American board certified, to know the main causes of this medical problem, the diagnosis, the signs, and possible treatment for future references with our dear audience. So stay tuned after this short break. Welcome back, dear viewers, after this short break, and welcome back, Dr. Fawzeya Alkhaldi in Doc Talk.
Thank you for inviting me again, and inshallah, in this topic, we're going to discuss a very important issue.
So last time we talked about anemia, now we're going to talk about the opposite, let's say, of anemia, or same?
Actually, no. So the opposite of anemia is hyperviscosity, but today we're going to discuss thrombosis, or blood clots. And people, when they think about blood clot, they think about heart clot or brain clot, but we're talking about the deep vein thrombosis.
Yes.
And it's actually a total different thing.
So explain it to us. You said it's not heart or cardio-related disease, so it's all over the body. So let's explain.
So the most common things that people know about are the arterial clots, so the heart clots or the brain clots, and this is very common, and everybody knows about them. Now we're going to talk about the silent clots, which are going to happen inside the veins, not the arteries. So the veins, they're going to be running all over your body, and usually there's these clots happen in the lower limb, so in the legs. Most commonly, they're going to happen in the legs, and they can migrate through the veins and hit your lung and cause what's called pulmonary embolism or lung clot, and this is a fatal condition. Yes.
So I remember I saw an episode of Dr. House about this condition. It was a leg injury, but it developed to...
Excellent, yes.
Yes. So,
yes.
Okay. Why are blood clots referred to as the silent, or the, let's say, the silent killer?
So as you said, a fracture. So imagine an athlete, a very healthy young man or a woman who's running and doing every certain healthy lifestyle.
Yes.
And suddenly they have an injury during playing a match or their sports, and they get a fracture. Once they get that fracture, people think that because these young girls or boys are healthy, they cannot get clots, because clots, where do they happen? In the brain or in the heart? And it's related to elderly. Unfortunately, vein clots has nothing to do with your age or atherosclerosis. So they're totally different, because it happens, as I said, in the veins, not in the arteries.
Yes.
So if you have a fracture, sometimes because of the stagnation of blood, you can develop a clot in the veins. People would think, oh, this man has a clot. He's a young man and he comes and complains of pain. Well, it's related to your fracture. Just go home, you're fine. And they will just not, they're not even going to bother to check them out. And I'm not talking about Kuwait. It's a worldwide thing, and that's why it happens. So these that man will go home and rest in bed, and that clot will grow more and more and more, and it will migrate and flow until it hits the lung, causing a massive pulmonary embolism and blocking all the veins in the lung, and that's where the heart will stop working, and that person will just collapse and die immediately
while sleeping. This is, let's say that this is one of the main causes of
sudden death
while sleeping. So
yes.
Because there is no pre-diagnosis of certain, let's say, small injuries, if it's like falling, twisting ankle, that would develop blood clots. Okay. How common are blood clots worldwide and in our region? Let's talk about Kuwait.
So I'm not sure of this, if we have a statistics, a recent statistics, but let's say, and we cannot make a generalized number in Kuwait, but I will tell you worldwide.
Yes.
DVTs are not rare. They're about 5 to 10% in the population, and they're mostly inside the hospitals. If you're going to be shocked, they happen inside the hospitals. Yes, and people have to be aware of the risk factors themselves to protect themselves. There's a program started by the American Society of Hematology. It's called Thrombosis Awareness. It was started 10 years ago, and since then the awareness was raised among everybody, among the normal population, and it helps to early diagnosis, early detection, and it maintained the people aware, so they protected themselves from having such problem or such condition.
Dr. Fawzeya, you said it happens commonly in hospitals.
Yes.
Is it because it's related to surgeries or ER or any kind of injuries? Because you said, I'm surprised that it's in hospitals, not in general life.
It will happen at home, but it will definitely more common in hospitals. So what happened? Let's say you got a fracture. You will be admitted to the hospital for 1 and 2 days or 3 days, and you'll be in bed. Being in bed by itself, bedridden situation, is gonna make your blood stagnant, and then you can develop these clots. People who have surgeries, as you said, whether it's an elective or emergency surgeries, will be in bed for a long time. They can develop clots. People who women who deliver their kids, and mostly in cesarean section, they can develop clots. So definitely, if you know your risk as a normal person, then definitely you will help the healthcare providers to put you on the list of people at risk of thrombosis, and then they will give you the prophylactic treatment and prophylactic measures. In Kuwait, thank God, we have protocols to prevent thrombosis in every hospital. But telling you from an international trained doctor, I know that until now, even though we have all the protocols implemented in every certain hospital, we still have patients that come into the hospital with no clots, developing the clots inside the hospital, and then either suffer from short-term death, God forbidden, or long-term problems.
Okay, is it related to blood diseases? Or, yeah, because let's say a normal healthy person.
Yeah, so let's talk about your risk as a normal person. So if you have congenital predisposition to thrombosis, we have many conditions that you could have these genes and you never know about it. Then you could be at risk of developing thrombosis. And the easiest way to know is by looking at your family members.
Yes.
If you're a female on oral contraceptives or giving birth to a child, because of the hormonal increase in the female hormones, you're at risk of thrombosis just by being on the oral contraceptives or being pregnant by itself. Also, if you're a bed-bound person and you're not moving a lot, even if you have a long trip, let's say going to Australia or going to Los Angeles from Kuwait.
That's why they told us when you are in a plane, wear compressing socks.
So if you're taking a long flight, it's better to start moving your legs, getting good hydration during the trip. Stay away from caffeines as much as possible, and even if you're in economy class, try to wiggle your legs, like you're pushing the pedal of the car, and then that would help to the circulation to move in your body. And never ever, like, my advice is never to take any sleeping pill on a long trip, because specifically if you're older in age, because you may be at risk of thrombosis. In the previous years, they were not given any awareness about this, but I'm trying to keep people aware that sleeping long hours during flight, for some reason, it has a problem with the being in the air.
Elevation.
Yeah, and a lot of people just land down with blood clots, and guess what? They think they have muscle cramp, and they will just limp for we call it Charlie horse. They just limp for 1 or 3 days, and once the pain is too much, or they get the pulmonary embolism and they get the shortness of breath, and they collapse, then people are aware that they develop a clot. And if you take the history, where were you? He was on a long trip, like 16, 14 hours trip. So even a 6 hours trip, I would advise people to stay hydrated, move your legs, and stay away from caffeine, stay away from sleeping for a long period to avoid having clots.
Okay, I'm going to jump into a different question. What is the difference between normal clotting that protects us and dangerous blood clotting? There's normal and there's safe and dangerous. That's
Yes.
quite interesting.
So let's say you cut your skin for like you were in the kitchen and you cut your skin. You should develop a clot to stop bleeding.
Okay.
People in surgeries, they should have these clot factors. They call them clot factors, and they help you to prevent further bleeding. So they will stop the bleeding and save your life, because if you bleed, you're gonna die.
Yeah.
So that's the safe clotting. Now, the abnormal clotting, as we explained, arterial or venous. And in this episode, we're concentrating on the venous because honestly, if you don't know your risk and it happens to you, then you're like, it's a fatal condition.
Yes.
And I've seen pregnant girls who, during pregnancy, because they tend to gain weight and their legs get puffed because of the swelling, they have fluid, and they have clots which are not noticed. And then, so my point from this episode is to raise awareness. If you're a pregnant or you have a swelling in your body which is abnormal, new, unilateral in one limb versus the other, and we talk about the lower limbs mostly, but it can happen in the upper limbs, in the hands also.
Okay.
So if you have one limb bigger than the other, definitely seek medical advice. Don't try to diagnose yourself by Google or using ChatGPT. Please refrain from that.
Yeah.
And go to a medical
consultant or someone with medical experience to address
help
this.
you.
Yes. Okay. Here in, let's say in the region, I don't want to say specifically here in Kuwait, which group of people is at risk?
Thrombosis, DVT.
Yes.
So as you said, people with fractures. If you have a fracture and you suddenly develop abnormal swelling somewhere in that fracture limb, definitely go back to your medical advisor and ask them for help. If you have, if you're on oral contraceptive as a female and you developed a new swelling, and usually the first clot will be a swelling. It will rarely you will develop a pulmonary embolism or a clot in your lung and you will die without having an obvious swelling. So if you notice a swelling unilateral and you're on oral contraceptive, definitely seek medical advice. If you're pregnant, believe it or not, the athlete people, because they think they're a goddess, they don't have problems because they're healthy. If you're an athlete person and you have a swelling somewhere or you're limping for some reason, don't think it's just a muscle cramp. Don't go and do massage or try to relax.
No, go to
seek medical advice and check that you don't have a clot, because you may have congenital predisposition to this, and it has nothing to do with your lifestyle. Definitely, if you're elderly, if you're morbid obese, and people who have recent surgeries, move. My advice is just to move. A lot of people, when they do surgeries or they develop babies, they stay in bed like paralyzed for 40 days or whatever, and it's not healthy at all. You should just move, because movement is medicine.
And it activates the blood circulation.
Whether you have osteoarthritis, whether you have broken limbs, if you move, you're bringing down your risk to zero.
Yes.
And we have a lot of modalities to help you as doctors, but movement is your first treatment.
Well, Dr. Fawzeya, we need to take this short break and to look into our new report. So after the break, we're going to talk about the symptoms and diagnosis and possible treatment. So please stay tuned. Welcome back, dear viewers, after this short report. And now with Dr. Fawzeya, we're going to talk about the symptoms or the early warning signs that developed DVT, as they call it.
Yes. So definitely we're going to mention the important thing that a normal person can look into them in his body, and then maybe he can go and seek medical advice. So swelling in one of the limbs, whether it's the leg, the thigh, the hands, the arms, anything, swelling. Redness of the skin. Usually the skin will be red and erythematous. Some people think they have allergy or they have insect bite, but it's a sign that they have DVT or thrombosis. Pain. It's usually muscle pain, so like cramps.
Cramps, especially at night when people are sleeping, they have like that strong cramp.
Definitely.
And they relate it to lack of, let's say, magnesium deficiency.
Or iron deficiency. But if it's a cramp that prevents you from walking normally and you're limping, then definitely you should look into it. And the latest signs would be shortness of breath, palpitation, heartbeats, higher heartbeats, or you hear your beats in your ears, and shortness of breath. That would be like the latest signs. So yeah, if you are at risk, so know your risks. If you're at risk, like we said, the risk factors, know your signs, and definitely you will seek medical advice on the right time.
Okay, now let's take a hypothetical situation. You in the ER and you just received a patient with DVT. What are the procedures and standards to treat that condition?
So first of all, we should diagnose. So the diagnosis is a crucial thing before treatment, because unless you know what you're dealing with, you cannot treat it rightly.
Exactly.
So diagnose, we can do so physical exam, heart exam, and we can do an ECG. They all can give us signs that this person has a blood clot. Then we move to the blood work. We can do a blood work. There's a marker in the blood work that is raised when we have DVTs. It's called D-dimer. And then we can do ultrasound, which is a gold standard, and CT scan of the lung if the clot already migrated to the lung. Because sometimes it is early migration and you can see small veins closed or blocked before you get the fulminant P and the death. So these are the full plan or protocol that we do for patients. And once we diagnose them, then we can treat them.
Okay. So we have something here that called primary embolism. I don't know. What are the symptoms of pulmonary?
Pulmonary embolism.
Yeah, embolism. What is it related to blood clots?
So pulmonary embolism, as I said, is the blockage of the veins of the lung.
Yeah.
And this is a deadly situation. It's a
this is, let's say before, it's in the later stages. If you don't catch it.
Yeah, and some people have pulmonary embolism as the first sign.
Oh, so jumping from minor signs?
They didn't notice the minor signs.
And then jumping to that condition and critical situation or level, and then sudden death.
Yes, so it's a very critical situation. And when your lung vessels are clots, there's no oxygen going or coming, and there's no life without oxygen. So it's a deadly situation, and it's a fatal condition.
So, okay, I have one question. Who's more risk? We talked about kind of population. Men or women are at risk?
Definitely women.
Okay.
Because of their conditions.
Okay.
But as we said, people who are stagnant, not moving, obesity, people who have or like a congenital predisposition, they carry these genes. So even a minimum amount of stagnation, sitting down for a few hours or flying, can trigger their DVT.
Okay. Can children develop DVT?
Definitely kids can have DVT, and we've seen them, but it's less common than adults. Yes.
Okay. Okay. What is the difference between arterial and venous clots?
So,
we talked about them.
Yeah. So arterial is like the common thing,
Yeah.
Heart and brain clots, because everybody knows that. But the venous is the thing that nobody knows about. That's the secret. So you have arteries and veins. The arteries that supply the body, and the veins that take away the carbon dioxide from the body. These veins, when they develop the clots, that's why, because they're not developed, they're not giving you oxygen on spot, so the clot can develop and develop and develop without you noticing, and then it will, as we said, migrate and blocks your lungs, blocks your hearts, and that's it.
Yeah, we talked about the veins and legs and limbs. Let's talk about the veins in the brain. Is the damage of veins clot more dangerous and deadly in the brain than the limbs?
So it definitely should be more deadly, but it's less common. So there's a common sites of DVTs, like the one I mentioned, because common is common, right? So the limbs are the most common sites, but you can have, they call them rare abnormal sites of DVTs. So as you said, in the abdomen, in the brain, in other parts of the body, you can have clots. Specifically clotting the veins, and they can cause damage to you, but they're not deadly as the common ones.
Okay. How do cancer and chemotherapy increase the risk of blood clot?
Excellent question. So the population, one of the most common population at risk is the cancer patient.
Yes.
Because of their abnormal cancer cells, they tend to produce clotting factors, and these clotting factors will cause you to clot. So people who have cancer are a very fragile population, and they have a high risk of clotting. And one of the protocols that people because when you treat the patient with chemotherapy, you should put the patient on blood thinners.
Yes.
And the population, the cancer population is so different from other population.
Yes.
They receive different blood thinners versus the normal population.
Yeah.
Some of the blood thinners that we give to the normal population, they will not prevent clots in cancer patients.
Well, that's interesting. I have another question. Is food related to blood clots? Can we say that? Because sometimes they say high cholesterol, low cholesterol affect the arteries and veins.
So definitely high cholesterol affects your arterial thrombosis, but not the venous. There have been no proven in any study that I'm aware of that diet has anything to do with clotting.
Okay. And my final question for this segment, are post-surgery blood clots different from those caused by daily lifestyle?
Post-surgery blood clots, as I said in the beginning of the episode, most of the blood clots happens in the surgery or in the hospital, related to bed stagnation. So you're in bed for whatever reason, you're sick, even if you have lung infection, let's say, or heart attack, and you're sitting in bed, you're not moving like daily at home. Then you can develop clots. The problem with post-fracture is because that fracture will cause swelling, so we cannot predict the signs. There's no signs, there's no symptoms. The patient already have a swollen limb, he has a lot of pain, he has redness, so he can't see obvious signs, and even if he complains, it's there already.
It's there.
So that's the only critical thing about fractures, because you cannot predict. But I can assure you that in Kuwait, as far as, let's say, about Kuwait, we have protocols to prevent thrombosis post-fracture. Every patient gets stratified and put on a certain medication or device to prevent clotting.
Well, Dr. Fawzeya, we would like to keep talking about blood clots, but we're going to jump after this short break to one of my favorite segments, Myth or Fact. Welcome back, dear viewers, to my favorite segment, Myth or Fact, with Dr. Fawzeya Alkhaldi.
Definitely my favorite segment.
Well, I'm glad that's your favorite because it's interesting. So, myth number one, blood clots happen only to the elderly.
False.
So it happens to everyone.
Everybody's at risk.
Okay. Myth number two, if you are physically active, you can never get blood clots.
False. Everybody is at risk, even the athlete person.
So let's say that the athletes are the top of the at-risk category because they get injured all the time.
They have a lot of injury and they have high tolerance to pain. They don't care. They go and do their sports even if they have cramps. So that's why they have not more risk, but they can be at risk without knowing.
Yeah, so that is important that to check after every game or after every competition.
If they have injury or something.
Yeah. So myth number three, only leg pain indicates of blood clot.
False. Sometimes you can have silent, as I said, blood clot that migrated and goes to your lung immediately, and it's going to cause death immediately. So definitely false.
Okay. Blood clots are always visible or obvious.
Definitely false. They're never obvious or visible unless you have them in the limbs. Okay. So as we said earlier, there's some blood clots that happen inside, and they could be, you have no signs or only...
No sign. Only sudden death is the common sign.
Sometimes pain, but a lot of them are asymptomatic.
Okay. Is there a difference between blood clots and, let's say, heart strikes? Let's say some people...
Heart stroke. So these are arterial.
Yeah.
And we're talking about the venous.
The venous, okay. Drinking water alone completely prevent blood clot? This is a very interesting question.
False. So it's a lot of things. So as we said, drinking, keeping hydration, mobility, and avoiding stagnation and sitting. So people, what they call them potato couch,
Yeah.
they're at risk of developing clots even at home because they're going to be sitting for long hours.
Okay.
And minimizing your intake of caffeine.
Okay. I have a question. Are diabetics at risk of blood clots?
Definitely, every person with a chronic disease such as diabetes, because it affects your veins and becomes more prone to developing clots.
Well, that's interesting. Okay. My final myth or fact: once treated, blood clots can never return. False. A big false.
In fact, if you have a blood clot, you are at risk,
Of developing
more
more.
at risk to develop other clots versus a normal population or a person who never had clots.
Yeah. Is it a permanent disease? We cannot say.
No. When we have a cause that is reversible or like a fracture, it could be the first and the last one.
Okay.
But if you have other diseases or congenital problems or chronic illnesses or a problem related to the veins itself, then definitely you're in a chronic condition and you need blood thinners for life. So some people would treat them for 3 months only, like the fractures, post-delivery, post-surgery, and some people will treat them with lifelong blood thinners.
Okay, well, that ends my myth and facts segment. So we're going to take a break and then we're going to continue with Dr. Fawzeya Alkhaldi. Welcome back, dear viewers, to the end of our episode today with Dr. Fawzeya Alkhaldi. It's our pleasure to have you, but before we end,
Mine.
well, you are a delight,
Thank you.
be honest with you. So give me a final message for the audience.
Sure. Final message, please keep aware that everybody is at risk of DVTs, as we call them, or deep vein thrombosis, whether you're healthy, whether you're thin, whether you're young, whether you're old, whether you have disease, whether you're not. If you're aware of the signs and symptoms, the most common signs of symptoms: swelling, leg swelling, limping, pain, and a red discoloration of your leg, please seek medical advice as soon as possible, because this is going to save your life. If you have a relative who's in hospital, please ask the care providers whether my relative is at risk of thrombosis, and if you guys are providing him with medication or devices to prevent thrombosis.
Well, Dr. Fawzeya, thank you very much once again for joining us on DocTalk, and we wish you all the best in your future endeavors.
Thank you, and pleasure is mine.
Well, thank you. And also thank you, my dear viewers, for joining us today, and until next time, enjoy your day.